Well, bye-bye back pain. We've got some solutions that go straight to the spine when we get back.
Good news.
All right, if you suffer from neck and back pain and you've tried just about everything to feel better, you might want to think about spinal cord stimulation. Dr. Dennis Karasek is with Spine and Pain Center of San Antonio. He's here to tell us more about that procedure, spinal cord stimulation. Thanks for being with us today.
Thank you. Tell
us a little bit about what that is exactly.
Well, I've been on before, and we'll have a little video showing it, but basically it's wires with little electrodes at the tips, and we slide them in above the spinal cord in a relatively easy procedure, just done in the office at first, and then we program the electrodes to impart a little stimulation to the back of the spinal cord. All these messages of pain are coming up from the low back, legs, or the arms, or the neck, and they travel in the back of the spinal cord, and it sort of short circuits them.
Now, back pain is caused from many different things. What are some of the most common ones you see?
Well, disc problems and surgery for fusions and other sort of significant back problems. Continued pain after surgery is probably the #1 indication in this country for spinal cord
Now, would you
stimulation.
say spinal cord stimulation is good for people with severe back pain, or if someone kind of always has a crick in their back?
No,
What's a good candidate?
It's not something for the weekend warrior who just gets a little crick in the back and a couple of days later after some Advil feels better. But this is for an indication for people who have severe debilitating pain on a daily basis, who may have had surgery, 1 or 2, sometimes 5 or 6 surgeries on their low back and neck, continued pain in their back or legs.
This is a very difficult thing to deal with, and you kind of told us a little bit about how it works, but this is one thing I love about it. There's 2 steps, and so it's kind of like you could try it out, and if you don't like it or it doesn't work, which it will, you can either have it implanted or go a different route. But tell us a little bit about that 2-step process, because it's very interesting.
First step is what we call the trial. We just bring people in. We do it in our office under light sedation, a little local anesthetic. It's not a painful procedure. We put the electrodes in, and then we test them to make sure that they get stimulation in the correct area. And then we just tape them up, program it, send them home, and let them try it for 1 or 2 weeks.
Now, what does it feel like because it is sending electrodes, correct?
Yeah, it's an electrical stimulation to the back of the spinal cord, and most people describe it as a sort of a tingle. It tells the brain that you just feel a tingle in the area that you hurt instead of feeling the pain.
And so, is it a constant tingle, or is it kind of like it's on? Is it always on? How does it work?
You can program it any way you want. These are made by the pacemaker companies, and so they're highly programmable. You just hold a little unit to the skin over the battery, and you can program it to do anything you want.
Now, you've had a very high success rate with this, and you were saying a lot of people get it, once they realize how much they enjoy it, they get it implanted, and it's just a permanent part, right?
Right. The second phase is the permanent implant, and if they do well with the trial, then, and that's about 75% of people usually do very well. We want at least 50 or 60% pain relief.
Now, spinal cord stimulation, the system you were saying, is not good just for back pain. There's a lot of other things it's being used for. Tell us about that.
In Europe, for about 25 years, they've been using it for, in fact, the #1 and #2 indications in Europe are for peripheral vascular disease and intractable angina. Peripheral vascular disease is real severe and sort of dangerously low blood flow to the extremities, usually the legs, arteriosclerosis, diseases like diabetes. It leads to amputations, a lot of pain. If people know diabetics out there, they realize that they sometimes will have multiple amputations on the same limb. In Europe, they have far fewer hospitalizations and amputation rate because they use spinal cord stimulation very early. They found that stimulators help the blood flow to areas, can stop the progression of the disease, decreases the pain, decreases their amputation rate.
Wow.
Just no bad things. And the most angina is a severe problem in this country. It's a heart pain that people take their nitroglycerin for. And after they've had multiple medications and maybe angioplasty, coronary bypass surgery, sometimes they're left with this intractable angina that they just can't get rid of. These people will go through a bottle of nitroglycerin just climbing upstairs, and there's nothing really to do for them. But in Europe, they've been using spinal cord stimulation for this, and it'll decrease their hospitalization rate from 3 to 5 per year to 0.
God.
It increases their exercise tolerance. These people will have 7 to 8 angina attacks a day. It can decrease it to 1 per week.
And so obviously in the economy we're in, where a lot of people are trying to cut back, you're saying this can really save on their medical bills, obviously.
Hugely. A hospitalization for chest pain is very expensive. ICU stays, catheterizations, and they'll have 3 to 5 per year. And their costs can be hundreds of thousands of dollars. If you can decrease that to 1 or 0 per year, that's a huge savings.
Hopefully save on pain medication. Those are always expensive too.
Everything.
So you were saying some of your patients have really said, listen, this has really changed my life.
Oh, absolutely. If you take somebody with who can't go upstairs without a bottle of nitroglycerin, certainly couldn't carry suitcases upstairs, etc., is always in and out of hospitals, you can imagine what quality of life they have. If you can decrease that to almost nothing, no pain, no hospitalizations, no nitroglycerin, that's a huge difference. They get to exercise, they get to go out with their family, they can do
better quality of life.
Absolutely.
Well, thank you so much. And if you have questions about this, the Spine and Pain Center San Antonio does have 3 locations. There's one at Wurzbach, Topper Line, and Westover Hills by SeaWorld. You can, of course, give the doctor a call at 615-1901. Of course, we'll have all this information for you at kens5.com, so be sure to check that out. Thanks again for being with us. Great information. I know a lot of people are thankful for